I am Angelo Agapay, a nursing student from the University of the Visayas. Today, I'm going to demonstrate the personal hygiene shampooing. So, here's my equipment. The towel, the 2 blankets, security pad, shampoos, the basin, and the water. Assuming that I already washed my hands and provide client privacy. Move the client to the side of the bed from which you will work. Okay, ma'am, can you move closer? So next, place plastic pad under the head. So I'm gonna use this security pad. So next, tuck a bath towel around the client's shoulders. Before shampooing my patient, I will cover her eyes first. Okay, can you close your eyes? So, we will start shampooing my patient. So, first, I'm gonna soak her hair with water. And we will put some shampoo. And then massage the patient's hair. So not that. And then we will rinse the patient's hair with water. And after that, apply shampoo again. Next that. Then rinse with water again. So after shampooing the hair, we will dry her hair. So after drying my patient's hair, I'm gonna remove my gloves. So after that, ask the patient if she's comfortable with her position. So ma'am, are you comfortable with your position?
Yes.
Okay. After doing all of that, document if there is an unusual abnormalities. So now I'm going to do the oral care. So assemble articles for brushing. So here are the equipments, the toothpaste, toothbrush, a small basin, a glass of water, and the towel. Okay, provide privacy. And next, place client in a high polar's position if health permits, or assist to a sideline position with the head turned. So ma'am, are you comfortable with your position?
Yes.
Okay, thank you. And next, Place the towel under the client's chin. So here's the towel. I'm gonna put this to my client's chin. Okay. Wash hands and apply disposable gloves. So I already washed my hands and see that I already wear my disposable gloves. Okay, next, place or hold the emesis basin under the client's chin or neck. So, okay. And moisten the bristles with dipped water and apply toothpaste to the toothbrush. Okay, so here is the toothpaste and the toothbrush. Okay, hand the toothbrush to the client or brush the client's teeth. So, mom, can you do it for yourself? And next, hold the brush against the tip with the bristles at 45-degree angle. The outer bristles should penetrate under the gingival sulcus. Okay, next, move the bristles up and down gently in short strokes from the sulcus to the crowns of the teeth. Next, repeat until all outer and inner surfaces of the teeth and seal of the gums are clean. And next, clean the biting surfaces by moving the brush back and forth over them in short strokes. Okay. Next, brush the tongue gently with a toothbrush. Next, offer the cup of water to rinse the mouth vigorously. Okay, water. A glass of water. Okay, thanks. And lastly, document assessment of the teeth, tongue, gums, and oral mucosa. So now I am going to do the shaving care. So first step, wear gloves. So I already wear my gloves. Next, apply shaving cream or soap. So assuming that this is the shaving cream, I'm gonna apply this on my clients. Next, hold the skin taut, especially around creases. And next, hold the razor with the blade at 45-degree angle to the skin. So, this is assuming that this is the razor. Next, shave in short, firm strokes in the direction of the hair growth. Okay, next, after shaving the entire area, wipe with a wet washcloth. Next, dry the face well. and pat on aftershave lotion or powder. And apply this lotion. So that's all. Thank you. So now we are going to do the bed bath. So first step, introduce self and verify the client's identity. So this is my patient, Christine Ngolan. And step number 2, explain what you're going to do and why it's necessary. So we should have to clean the patient's body. Okay. Next, perform hand hygiene. So I already washed my hand, and as you can see, I am wearing my disposable gloves now. So next, provide for client privacy. So you can see the window and the door are closed. Next, prepare the client and the environment. Ensure a comfortable room temperature. So next, position the client appropriately. So are you comfortable with the position? Okay. Next, place a bath blanket over the top sheet. Remove the top sheet starting at the client's shoulder and moving down, leaning toward the client's hip. So this is the bath blanket. I'm gonna put this on my patient's Next, remove client's gown and while keeping the client covered with the bath blanket. So we have to remove this. So this is the used blanket, and we're going to put this in the linen basket. Next, remove client's gown while keeping the client covered with a bath blanket. So we have to remove this. Next, fill wash basin 2/3 full. Test temperature of water. So we have to test the temperature of the water, and it's not that cold and it's not that hot. So it's warm. And make a bath mitten with a washcloth. Okay. From wrist to axillary. Okay, next, wash the chest and abdomen. Place the bath towel lengthwise over the chest, folding the bath blanket down to the client's pubic area. Okay. Good. Next, wash the back. Assess the client into a prone or sideline position facing away from you. Place the bath towel lengthwise alongside the back and buttocks. Keep the client covered with a bath blanket and wash and dry client's back from shoulders to buttocks and upper thighs. So, ma'am, can you please on that side of the wall? Thanks. Okay, next, wash the legs and feet. Expose the leg farthest from you. Fold the bath blanket towards the other leg, keeping perineum covered. Place bath towel lengthwise. Now, can you go back to your position? Have to fold the blanket. And wash the feet in the basin of water. Mom, can I have your feet? I don't want to. After soaking the patient's feet, dry the feet of the patients. Dry the patient's feet. Next, drape the client and wash the perineal area. If cannot perform independently, assess with grooming aids. Next, put on clean gown. So this is the patient's gown. Put the used blanket in the linen basket. Next, assess with care for hair, mouth, and nails. So, Next, I'm going to do the nail care. First step, soak one hand in a basin of water and dry well. Okay, ma'am? Get your label. Next step, cut straight across beyond the end of the finger. So I'm gonna use this nail cutter. Okay, next step, use a nail file to round the corners. So this is the nail file. Okay, next, clean under the nail. Okay, next, gently push back the cuticle, taking care not to injure it. Okay. So next, apply hand lotion or mineral oil. So this is a lotion. And after that, record and report any abnormalities. Next, I'm going to do the foot care. So, I am Angelo Agapay and this is my patient today, Miss Christine Gulang. This is my equipment, the towel, the orange stick, the soap, and the lotion. So, I already washed my hands and it is already clean. So, place one of the client's feet in the basin and wash with soap, including the interdigital areas. So, ma'am, can you please put your feet in the basin? Sure. So, I'm gonna put some soap and clean the feet of my patient. Okay. I love your feet now. Next, rinse the foot well. Okay. And rub callous areas of the foot with the wash cloth. So next, replace the water and allow the food to soak for 10 to 20 minutes. So after soaking 10 to 20 minutes, clean the nails with orange stick. So, assuming that this is the orange stick. Okay, next. So next, blot the foot gently with a towel and dry thoroughly. Next, apply lotion or foot powder. Okay, so after doing all the steps, document any foot problems observed.
Now let's proceed to perineal and genital care. Perineal and genital care is cleansing of the external genitalia, perineum, and surrounding area. It is also referred to as perineal care or peri-care. The purpose of this is to prevent or eliminate infection, and odor. Next, promote healing, remove secretions, and lastly, provide comfort. Okay, first step, introduce self and verify client's identity. So, you need to get to know your patient, and same as the patient should know you so that you'll be able to know each other and communicate with the patient well. Okay, next, explain what you are going to do and why it is necessary. So, it is necessary to do for us to assess for the presence of irritation, excoriation, inflammation, and swelling. Next, perform hand hygiene. Washing hands or sanitizing hands can keep you healthy and prevent the spread of respiratory and diarrhea infections from one person to the next. Next, provide for client privacy. So, maintain the patient's privacy so that the patient won't be exposed. Okay. Next, fold the top bed linen to the foot of the bed. Next, place a bath towel under the client's hips. So, placing a bath towel under the client's hips is a way of which the water is going flow so that it would flow to bed sheets. Females, place in back lying position with knees flexed and spread well apart. Cover body and legs with bath blanket and drape the legs. For males, place in a supine position with knees slightly flexed and hips slightly external rotated. Put on gloves and wash and dry the upper inner thighs. For males, position the patient to supine position because it is the only position that is required for you to be able to do the procedure easily, and also it makes the patient feel comfortable. Wear gloves to protect our hands from infections and contaminations. Next, inspect the perineal area. So this is to check if there is a problem to the perineal area of the patient. Also to check if there are abnormalities. For females, clean the labia majora and the folds between the labia majora and the labia minora. Use separate quarters of the washcloth for each stroke. Wipe from the pubis to the rectum and rinse the area well. For males, Wash and dry the penis using firm strokes. If uncircumcised, retract the prepuce and clean the glans penis. Wash and dry the area. Washing the penis to remove any dirt and any forms of bacteria around penis. This is to ensure that the glands and penis will be clean as well. The scrotum to remove dirt and germs and dry. Inspect perineal orifices of intactness. This is to make sure that there were no problem around the perineal orifices. Next, clean between the buttocks. The next is to make sure that you clean the buttocks or between the buttocks. Lastly, document any unusual findings. So document the unusual finding or any abnormalities to the perineal area of the patient so that you'll be able to identify and address the problem. That's all for the genital and perineal care. Thank you.